Hi, everybody. This is Denise. Good afternoon, our COPD and asthma heroes. I'm Denise Goslin, a respiratory therapist and asthma educator, as well as the program manager at Nightingale Virtual Respiratory Care by Healthcare Originals. On behalf of the Nightingale staff, I would like to welcome and thank you for taking a few minutes out of your afternoon to participate in our fifth live session. The first four sessions are pinned to the top of our Facebook group pages. In the chat, please put your name, your first name, and the state of where you're from so we can see how far and wide we are reaching people. Also, please write any questions that you might have in the chat and we will get to those. So I want to give a shout out to Jan in Colorado and Eric in New York and Savannah in New York, Cindy in Massachusetts, Yvonne in New York. Thank you all for being here. Charlie in Massachusetts. And before we begin, I'd like to remind you that these tips on how do I manage my seasonal allergies are general information. Always talk to your provider about your best options for your individual case. All of us have different medical histories, and after you, your healthcare provider knows you best. So let's get started. How do I manage my seasonal allergies? According to the Centers for Disease Control, in 2021, 26% of adults and 19% of children in the United States were diagnosed with seasonal allergies. This leads to 4.1 million healthcare provider office visits each year. So if you have seasonal allergies, you're not alone. Seasonal allergies, or allergic rhinitis, as the medical term is, or hay fever, which is another name for it, is an immune system response to pollens from trees, grasses, and weeds. Pollen is a powdery substance that's created by some trees and plants as part of their reproductive process. People with allergies, immune systems recognize pollen as a foreign substance. The immune response creates histamine, leukotrienes, other chemicals, and inflammation or swelling. And these responses create the itchy eyes, the sneezing, wheezing, coughing. The best way to prevent allergies is to avoid the trigger. But we know that's not always possible, especially with seasonal outdoor allergies, because every time you go outside, the trigger is there. So, and that's especially true in the spring and the fall. Let's begin by talking about the quiz on Facebook. The question was, what are good ways to avoid seasonal allergies? The first answer, A, was taking a shower at night instead of in the morning. Yes, that is the correct answer. Getting the pollen off your hair and body to avoid bringing it into the bed and having it with you all night is the best way to avoid allergens. Keeping the window open, which was choice B, was incorrect because that will allow the pollen to come into the house, which you don't want to do. You don't want to put a fan in the window and then pull in the pollen. You want to try to keep the windows closed and use air conditioning. If you use fans, ceiling fans, or a fan on a stand is better, but you also want to make sure you clean off the blades because they can harbor dust, and then you're just blowing the dust around the room. C was hanging the sheets out to dry on a clothesline, and that's incorrect. The pollen will stick to the material, and you will bring the pollen into the house and into your bed. So as nice as it is to have the sheets hanging outside and they smell so nice, and I like that too, but for people that have seasonal allergies, drying the sheets in a hot dryer is the best thing because it's going to help to kill the dust mites and it's going to avoid bringing the pollen into the house. So the answer D was all of the above, and that was incorrect because both B and C were incorrect. So 60% of our asthma heroes and 45% of our COPD heroes got the correct answer, which was A, to take a shower at the end of the day. So good for you, and thank you for participating in our monthly quiz. In addition to trigger avoidance, which we just talked about, let's go through other ways to manage seasonal allergies. First, pollen count. That's the measure of pollen in the air. If you watch your local weather report, either on the internet or on the TV, when pollen that you're allergic to is high in your area, the best thing is to stay inside if you can. Keep the windows closed, use the air conditioners to get the pollen out of the house. Wearing a wide brim hat and your sunglasses are going to help with your eye allergies and keeping the pollen off of your eyes. So you also want to avoid being outside in the early morning when the pollen counts are high. Save outdoor activities for late in the day or after a heavy rain, as the rain will wash away the pollen. Then there's medications. Talk to your healthcare provider about the many medications that are on the market, both over the counter and by prescription, to treat allergy symptoms. Be sure to discuss side effects and interactions with your current medicines, supplements, and any chronic conditions you have. To get a better response from your medicine, start taking your allergy medication 2 to 4 weeks before the allergy season starts to build up your body's response to the medicine. So if you know on June 1st you always start sneezing, mid-May you want to start taking your medication. Or if you start in April, let's go back to mid-March to start taking your medication so that your system is ready to fight and to have a tolerance to those allergens. And also remember that these medicines are used to treat your symptoms. They're not going to cure your allergies. So if you stop them, the symptoms will return. So we're going to go through the categories on the different types of allergy medicine that's out there. I have no relationship with any pharmaceutical company, so I don't get any kickback. I will give you a few names of some of the popular ones that we see on commercials on TV. They certainly are not the end-all, be-all to the list, but they might help to kind of trigger you into, okay, that's what the kind of medicine she's talking about. So antihistamines are probably one of the most common allergy medications out there. And those include things like your Allegras, your Zyrtex, your Claritins, your Zizals. Astelin, it's a nasal spray. Panthenol is an eye drop. It can be in pills, liquid, nasal sprays, eye drops, and they block the histamine chemical reaction that causes the sneezing, the postnasal drip, the nasal congestion, and the itchy, swollen eyes. Corticosteroids come in a nasal spray for allergies. Flonase and Rhinocort are a couple of those, and they get that nasal inflammation or swelling down. For people that have a really severe allergic reaction, they may even be put on prednisone, which is the pill or a liquid form of the corticosteroids. And then for people that have skin reactions, hives and itchy redness, scales, there is triamcinolone cream, which is a steroid cream that they can put on. Anti-leukotrienes, such as Montelukast or Singulair, stop that leukotriene chemical reaction, and that's what causes the nasal swelling, the runny nose, and sneezing. Mast cell stabilizers, such as Nasocrom, are used to reduce mild to moderate inflammation by preventing the release of histamine from mast cells. Those are the cells that make and store the histamine. They also have an anti-inflammatory effect, but they're typically not as effective as the steroids, and they do come in a nasal spray, and they also come in eye drops. Anticholinergic nasal sprays such as Atrovent help to reduce a runny nose. And then we have the decongestants, things like Afrin, Sudafed, combination medicines like Allegra D or Zyrtec D, and those are for the quick temporary relief of nasal and sinus congestion. And there are limitations onto the duration of using such a nasal spray. You don't want to use a decongestant nasal spray for more than 3 days because it can cause rebound, which is an increase in swelling in the nose, and maybe also they may be contraindicated in people with high blood pressure, cardiovascular disease, glaucoma, and hyperthyroid disease. So if you need to be using a decongestant for more than 3 days like that, you want to talk to your doctor because there may be other medicines that they might want to try with you. Biologics, Xolair and Dupixent are injections that are used to prevent a specific immune system reaction in asthma and allergies. So what else can we do? Besides avoiding the triggers and medicines, there's immunotherapy. Those are allergy shots that are given when a small amount of the substance you're allergic to is injected to build up the person's immunity or tolerance to that substance. A newer version is sublingual immunotherapy that includes tablets that have a small amount of the allergic substance that's placed under the tongue to dissolve and build up the immune system or tolerance without the shots. Those are only available with grass, ragweed, and dust mites. Nasal washes, such as using a neti pot or a squeeze bottle like this, or a rubber nasal bulb, pour saline or salt water into one side of your nose and then it comes out the other side. It rinses the sinuses and the nose. You got to lean way over the sink. It is a messy process, but it does help to clean out the mucus and the phlegm that gets in there. And then you can feel a little more comfortable. Again, it's not going to cure it and it's not going to last, but it might make you feel a little bit more comfortable. And a hint from someone who's used this, you also want to do it a few hours before you lay down. So if I do it in the like after supper time, and I got a few hours before I go to bed because you continue to drain for a few hours afterwards. You'll move your head and all of a sudden, liquid comes out. And so you don't want to be doing that when you're lying down in the bed trying to get to sleep because it's a nuisance, I'll tell you. But the other very important thing to remember with nasal washes is to use distilled water or sterile water, or boil your tap water for 3 to 5 minutes and then let it cool until it's lukewarm. Previously boiled water can be stored in a clean, closed container for use within 24 hours, according to the Centers for Disease Control website. Tap water may be safe for us to drink because the stomach acid in the stomach kills the bacteria. But using that same tap water in a nasal wash, the bacteria can stay alive in your nasal passages and cause a brain infection. So that's a very serious complication. So you really want to avoid that. Now, a couple of questions we got ahead of time were, is local honey good to prevent allergies? Which was a great question because I've heard that over the years a lot. But the studies are inconsistent on the results. The theory is honey contains pollen, and like allergy shots, having local honey every day would build up a person's immunity or tolerance. The problem with that is the pollen in honey is from flowers, which rarely cause seasonal allergies. The pollen that usually causes the allergic reaction is from trees, grasses, and weeds, not really flowers. So raw local honey may also contain mold, bee parts, venom, or bacteria. So that is removed when you have commercially prepared honey. So if someone is allergic to bees and has raw honey that contains bee parts or venom, that could cause an anaphylactic reaction. So you also don't want to give honey to anyone under 12 months old. The other question we got was, will allergy shots relieve my asthma? If you are 5 years old and older and have allergic asthma and symptoms that worsen after you get exposed to things like pet dander, dust mites, pollen, the research suggests that the allergy shots may offer a small improvement in your quality of life, your symptom control, and could reduce the amount of asthma medication you take. While sublingual tablets have been approved by the U.S. Food and Drug Administration for treating some allergies in people who have allergic rhinitis, which is the nasal symptoms, with or without the conjunctivitis, which is the eye redness, swelling. Neither tablet nor liquid immunotherapy has been approved for treating asthma itself. Sublingual therapy is beneficial for the allergic rhinoconjunctivitis, in other words, the nasal and eye symptoms. It's good for the allergy part of it. In an individual with allergic asthma, sublingual therapy for allergic rhinoconjunctivitis might reduce the symptoms of allergic asthma as well. And this potentially provides the rationale for making the recommendation conditional. So, in other words, the National Institute of Asthma guidelines say it's not a blanket recommendation for everybody. Currently, only tablet sublingual therapy for ragweed, dust mites, and for grasses have FDA approval for the treatment of allergic rhinitis with or without the conjunctivitis. Sublingual therapy is not Food and Drug Administration approved specifically for asthma treatment only. Any other questions? Feel free to put them in the chat. And if you think of any after this, we're going to post this later today or early tomorrow, and you can at that point add some questions and we'll get to those. So I want to really thank you for your time today. Our next Nightingale Live session will be, why is it so hard to quit and stay quit smoking and vaping? This will be at the end of May with Jan, one of our respiratory therapists, and Sarah, our health and wellness coach. So stay tuned on our Asthma and COPD Heroes social group by Nightingale Facebook pages for more information. And again, thank you. We are so happy you're here and have a great afternoon. Bye-bye.